Hello and welcome to Talk Truth. My name is Corey Huntsberger. I've got my father, Alan Huntsberger, in the studio, and we're going to start off with our foundational verse. The earth and everything in it, the world and its inhabitants belong to the Lord. For he laid its foundation on the seas and established it on the rivers. Psalm 24, 1 and 2. We've had him on before. We're having him on again. His name is Dr. Gary Davidson. Dr. Gary, thank you for being on the show.
Thank you for having me.
Can you give us a little bit of a background about you and what you've done in the medical field? We've got new people that jump on the show all the time. They don't know who you are. Give us a little bit of a background about you before we get on to our conversation.
Well, I'm trained as an emergency physician. We live in central Alberta in Canada, on a little farm on the edge of the city, and I have 4 kids and 4 grandchildren. I worked in the emergency department in Red Deer for 16 years. I was head of emergency medicine in a central area here over about 500,000 people for about 4 years. And during COVID, I made a bit of a stand and said some things that weren't super popular in mainstream, and ended up not doing that anymore. And now I work, I wrote a report for the government on Alberta's response to COVID. And we did a review of all the health data from not only Alberta, but from around the world to see what our response looked like, and then what do we do going forward. And so that's what I'm involved with right now. I do a little bit of clinical work, but mostly that's what I do.
Well, the interesting thing is that, so how did the province accept your report? That as you look back on it, and there's been several weeks, if not months, that have gone by now, how'd they handle your report?
So it's been mixed. The premier has made quite a few changes from some of the recommendations in the report, and but not everybody's been really excited about it. So it's been kind of back and forth.
When you talk about not everybody, you're talking about the professionals versus the general public.
Yeah. Well, the professionals, like my colleagues as medical professionals, many of them don't agree with me, and that's okay. When I talk about some acceptance, I'm talking more of the government or, ministers in the government. And so some of them appreciate it and some of them don't, and that's okay. And that's with any report.
Maybe we should send them some of our mail of the people that we get across Canada, and let the Canadians speak to your professionals. Because it's amazing to me. We think that a lot of people are asleep, but they're not.
No, there's a lot of people afraid. I'm not sure how many are asleep anymore, but there's a lot of people afraid. I've been down. So one of the contributors on a report was Dr. Jay Bhattacharya. At the time, he was a professor at Stanford, and now he's actually the director of the NIH. So the NIH is National Institute of Health of the United States, and he only has 2 bosses that can fire him. One is Donald Trump, and one is Robert Kennedy Jr. So he's fairly well respected in the health environment in the United States, and whatever happens in the NIH and the FDA and the CDC trickles down to us. We don't have our own equivalents of that, so whatever they do, we follow. And so I've been in Washington a couple times and sat down, had some meetings since and before, and so I know what the feeling is, and I know what they know. I know what the truth is. I'm not guessing, and so it's really hard to translate the truth to the front lines without creating chaos. And again, I won't speak for him any more than I'll speak for the premier, but it's a difficult job sometimes to know what the truth is and to try to get that truth across to people who are resistant to accepting what the truth is. And so that was one of the things that we did, is we reviewed all the health data that was used to make our decisions here in Alberta and then around the world, and we compared and saw what happened and saw what maybe should have happened and then what we should do in the future. And there was definitely a lot of concerning aspects. I know that you guys have gone through some of the report or all of the report, and we didn't do very much of it very right. There was so much collateral damage to to the the response we had. We closed down schools and masked the parents, so the kids fell behind in their language and learning. We we closed down businesses, and so many people became hopeless and gave up. And some lost their lives, some walked away from their businesses and lost everything they had. Some made decisions that they absolutely hated themselves for, but felt they had no other choice. So there's a lot of trauma. And I was just talking to a few nurses this week, actually, that I've worked with. And it's like they have PTSD. I think they have PTSD from what happened. And not just the ones that chose not to get vaccinated, but even the others, because of what happened and what happened after. And yeah, it was just quite a time. And I think there's lots to learn about humanity from what we went through.
Well, that's one of the main questions we wanted to ask you is why are there some like yourself, like other doctors, Dr. Charles Hoff and others, that were able to say, wait a minute here, I have some questions, and then face the fire, the firing squad, and not change their tune, but continue on down the path of, hey, let's be cautious. I have questions.
Right.
Why, and like you said, nurses, there were some in the medical field that were able to do it, but the majority were not able to make a stand or be cautious or, ask questions. What is the difference? How do you, what do you prescribe that difference to be?
Well, I think that the whole COVID response, the whole COVID, all of it was a religious experience. And I don't mean a good religious experience. It was just a religious experience. So somebody, like in talking to Dr. Bhattacharya, Francis Collins, the prior director of the NIH, Dr. Anthony Fauci, the head of his department, these people, we have lots of record of them trading narrative, as if you want to call it that. And they created a lot of fear to cause people to want something. And so I just say that they created a hell. And their hell was COVID, getting COVID, your grandma getting COVID, you dying of COVID, everything, losing everything to COVID. And then they said, but there's a savior coming. And the savior is only the vaccine. And every other savior you think, any other treatment or way to avoid getting COVID is a false god. And they sat, and so they were the high priest to this new savior coming. And so we watched them on TV every day, sharing their religion. And people bought the fear because it seemed to be real. They sure used a lot of props. And then they sold this new God. And they were the high priest to this God. They were the only access to it. And so you had no choice but to take it. It was a religious experience. And so people fell for it because they were threatened to lose everything. That was their hell. And their God was presented and they accepted it. And so for people to then undo what they believed, I believe, especially as Christians, because if we accept that, we say, wow, I really fell for something. And so it's really hard. It's like somebody coming to me and saying, Gary, your God is dead. Let me show you some papers here, some nice peer-reviewed journal articles that show you that your God is dead. And I'm sure there's some peer-reviewed journal articles that say God is dead. And I would just say, yeah, I'm not that interested in reading that. And that's what we're up against. And so it was a religious experience. Therefore, the only way to stand against it, for me anyway, was to have a greater religious faith than what they presented. Their fear wasn't as big as the fear I had. So it says, to me, as a Christian in the Bible, it says, the beginning of wisdom is fear of God. And so I had a fear of God. I want to know what he said. And so that fear was greater than the fear they had. Their fear of, we'll take away everything. And they told me that. We will take away everything if you don't do what you're told. And I says, well, I don't have as much fear of that as I do as fear of God. And so then it allowed me to say, you can have it all. But, the question is, how do you get there? There's a lot of people that call themselves Christians, but don't have a faith to get them through anything. And so it's nothing about me. It's just through things that God had taken us through and shown us, and I guess through it we developed the faith. when I was 17, I fought with God. I had enough of being afraid of whatever. I knew all about hell. I grew up knowing what that was. And I was just sick and tired of being afraid of it. And I just said to him, I just said, if you're not real, I'm not interested. And so we had a little bit of an argument one night. And he showed me that he loved me so much that he'd sent his son to die for me. And that if I accepted him, he would give me more than I could imagine. But it seemed like you had to give up everything to do it. And he says, I know, but remember that I loved you so much, I sent my son to die for you. So if I ask you to give up something, it's because I have something more for you. That was a hard decision at 17 years old. There's some things you don't want to give up at that age or you don't know enough about. But it's something I went through and it changed my life. And then, how many years later, about 12 years later, married with 2 kids and just wasn't doing what I felt I should be doing. I wasn't doing what I felt God had asked me to do with my life. So I started praying in September 95 and just asking God what he wanted me to do, and had a young family and didn't know what it was, but I just knew what I was doing wasn't right. And in the spring, I had a prayer partner just come and say, what would you do if God, if everything was done, what would you see yourself doing? And I said, oh, I'd be a doctor. I'd never said that in my life before. I don't even know if I'd thought that before in my life. And it was just something that I guess was in the back that I felt. And he said, then you should do it. And I said, how do you do it? You have 2 small kids. I have a good job, but there's no way I can live on no money for 10 years. I knew there was a lot of schooling involved and I didn't really want to go to school. And he said, if God tells you to do something, just do it. And I just easy for him to say. So I promptly did exactly what Jonah did. I went the other way, went and started a business with one of my brothers in another province. And as soon as I got there, I realized that wasn't what I was supposed to do. And I started praying again. And September 7th, 1996, I'm walking with my son, who was 3 at the time. Now he's 32. And we bought some stocks at Christmas time for $3,000. And that day they were worth $64,000. And my big thing was, how do you go to school with 2 small kids and a wife and no income? And how do you pay your way? And I just didn't have the faith to do it or understand how it could be done. And that day when those stocks were worth $64,000, I thought I was rich. I was 31 years old and my son was 3. And we were walking to the store to buy a Slurpee, actually. I'm holding his hand and we walked by this big Dodge truck. And I looked at that and I says, hey, Dan, we could buy that truck cash today. We were that rich. And I heard behind me, as clear as a bell, when I tell you to do something, you do it. I can make money out of nothing. And I didn't imagine that because I wasn't thinking that. I wasn't wanting to hear that. It's not like I wished I'd hear that. I just heard it. We bought our Slurpees. I went home and I told my wife that we were going to school, that somehow we're going to do this. So, and she just said, okay, we'll do that. And so we started looking. We had no idea how to start. Anyway, long story and 1,000 things that God had to work out for us to get there. And we went to school. So we went through that and I realized that God can, if he calls you to do something, he owns the cattle on 1,000 hills. We all sing the song and don't know what it means. We don't actually believe it. But I believed that, or I came to believe it. And then in 2012, I'd been a doc for a few years, 6, 7 years. And my daughter at this time, she was 16, developed cancer after we did a mission trip in Haiti. And came home and it's a bad cancer. It wasn't a mild one or whatever you want to call it. And I remember, just sitting on the couch with my wife and we'd have other people come and pray with us. And kind of the week between we knew it was cancer and before anything started, we just sat on the couch and prayed and listened to music. And God just showed me that this is that he wanted to heal her, but like the paraplegic in the Bible, where his friends carried him to Jesus, somebody needed to do that for her. And in my mind's eye, I saw her. Sorry. On, just like how the paraplegic in the Bible, his 4 friends picked up his bed and carried it, one on each corner. Well, there's 6 people that picked up. Michaela was sitting in the middle of the room in my mind's eye, and I saw this, and 6 people picked it up, and I knew who 2 were, and 2 and 4 I didn't know. I didn't think much about it, but the 2 I saw were her older brother and her grandpa. And I just knew what that meant. So I just told those 2 that were there, they were there, and her Pam's dad had just become a Christian. And I just said, God's asking you to carry Michaela to him for healing. And sorry. Over the following year, God brought the other 4 people into our life. Hundreds of people prayed for Michaela. But there was 4 people specifically who came into her life, and when they prayed for her, God said, and there's another. Until all 6 people had been there. And what I realized is they were obedient when God asked them to pray for her. And we were obedient when God asked us to take Michaela to different places and things that put her where these people could pray for her.
Mm.
And if we'd been afraid and sat in our house and felt sorry for ourselves, we would have missed that. If they hadn't been obedient, they would have missed that. But we were faithful. Those people were faithful. And God used them. So, and it was all sorts of people. And some of them were just miraculous. The last person was, we were flying, chemo was done. We thought she was healed. We were flying to Costa Rica to her cousin's wedding for her Make-A-Wish trip. We're at gate B24 in Houston. I'll never forget it. We went pre-boarding because she's in a wheelchair with no hair and her legs in a cast because of her surgery that wouldn't heal. And her toque said Canada, and it was probably 30 degrees in Houston at the time. And I bumped into the gentleman in front of me with her foot as we were going on pre-boarding, and this gentleman turned around and looked at her, and because her toque said Canada and because she had her leg in a cast, he says, "Oh, you must have broke your leg skiing," because I guess that's all we do in Canada. And she said, "No, actually I had cancer and I'm going on a trip to my cousin's wedding." And he said, "Do you mind if me and my 4 friends gather around you and pray for you?" And they did right there. We just stopped pre-boarding. And these 4, their pastors going to a conference in Costa Rica, they just put their hands on her, prayed for her right there. And God said it, and there's another one. And that was the 6th person. And we went to Costa Rica. She had 0 immune system. She had no white count. If you know what that means. We didn't mask her on the airplane. We didn't keep people from touching her. We just said, she can die of cancer. We don't have to worry about all that other stuff. God can look after her. We went through that, came home, and when they scanned her, they realized the cancer had actually spread all through her body. She was all through her lungs. So they did a surgery and found it all through her lungs and just said, "There's nothing more we can do. Just go home and enjoy your time. And, not much chance you're going to survive this." And so we went home, and I took her out of the country, actually, and did a whole bunch of treatment. But in the end, she's turning 30 next week or 2 weeks. Mm-hmm. She's fine. But what God showed me,
Gary,
is that He can do anything. He can heal you from something that they say that you can't be healed from. He can give you the money to do something that they say you can't do.
Yeah.
So when COVID came along, it was serious. We heard rumblings in December 19. I'm the head of the department. I'm the head of emergency medicine. We're the front line for the bad things that come in. So we knew it was going to hit us. And in January 2020, you could still look up what the truth was. And I realized that this virus, parts of it were engineered, and that was very concerning. Parts of it were patented by a company years ago. So it wasn't new, it wasn't novel. And I thought that was very suspicious. And I started bringing it up, and I started getting in trouble, which made no sense to me. I didn't understand. Well, they said people are very afraid. You're making them more afraid. You're making it sound like a conspiracy. And I said, I'm not making it sound like anything. And then pretty soon you couldn't find that stuff on the internet. So I had saved most of it. And so I knew the truth, and I knew there was something really wrong. And we went to Arizona just before they locked down. We had to put away all of our stuff that we had out there in the desert, and came home and realized it was just unbelievable, the craziness. And then they started telling us we first masks weren't going to help, and then you had to wear a mask. Well, I had saved all the studies on masking to show that they didn't work. And if you looked in even Alberta Health Services training from the year before, is saying that when respiratory viruses come through, a simple mask won't help you, don't bother. That was in the nurses training manual. I still have that. But all of a sudden we're being told, and then when I'd say, well, guys, they don't work, I was getting in trouble because, you're creating fear. And I said, no, I'm not creating fear. Somebody else is creating fear. And why are they doing it? What do they want to sell? Because there was no talk of a vaccine yet. And then pretty soon they started working on the vaccine. And when the vaccine study was mostly complete in October, November 2020, I actually got a copy of their report from Pfizer, from the paper. And it was horrible. It was, first of all, it was two-month study, which can't tell long-term problems. It's a genetic therapy, which FDA's own guidelines say you have to test for 15 years before you give it to people. So we have no idea what it's going to do to people. There's no way in God's green earth you believe for a minute it was going to stay in your arm, which of course has been proven it doesn't, but they told us it did. More people died in the vaccinated arm of the study than the unvaccinated arm, not necessarily from COVID, but from other things. But they said, oh, that's just whatever. And I said, no, it's not whatever. There's not a vaccine study in the earth in which the vaccinated arm died of any cause more likely than the non-vaccinated. And I started getting in trouble for sharing this. I had Pfizer's own paper. I got my pharmacist actually in the department to print it for me. I highlighted these parts and I'm passing it to my colleagues and guys, this is crazy. Like, what are we doing here? You can't do this. I was getting in trouble. This is Pfizer's own paper. I still have it. It's hilarious. But I started getting in a lot of trouble and I said, okay, there's something really wrong with this story. And so that's 2020 and 2021, the vaccine rolled out. And I said, no, number one, all of them were either tested against aborted fetal tissue or cultured on aborted fetal tissue. Johnson & Johnson and AstraZeneca are actually grown on dead baby tissue. And if you have no problem with that, that's whatever. But for me, I couldn't do it. And even testing it against it, I looked up, they tested against HK263 cell line. I looked it up and that's an aborted fetal tissue. And I just said, I'm not taking that. I just can't morally. And I had Christian colleagues and I'd say, guys, you're more pro-life than anybody I know. What are you going to do with this? And their answer was, well, we're so afraid we can't sleep, so we're taking it anyway. I'm just like, how do you say that? How can you say that morally? But, and so then in March 2021, actually, we went to Texas for 6 weeks because they were doing things very different than us. Dr. McCullough, if you've heard of him, I'm sure, was testifying in the Senate saying, don't lock down. It doesn't work. Don't mask. It doesn't work. Let's watch. If we treat people and look after people, we can deal with this. So I went down there and I'm physically watching the Texas health dashboard, just like Alberta Health Services had one. And I'm watching their hospitalization rates, their case rates, their death rates. We're just everywhere in Texas watching. Everything's wide open. Schools are open, businesses are open. And then I'm watching their dashboard as their case rate drops. And he said it would drop 85% in 4 weeks. It actually dropped 89%. And so I watched this real time, and then we drove home. And one thing I'd realized, and while we were down there, I talked to these doctors who were world renowned, and I'm just a small time doc from Red Deer, Alberta. And I talked to them and just asked them, really, can you treat this? Is there really treatment? And so they sent me their stuff, and I read the papers, and I'm doing the research, and I'm seeing that there's no reason why it shouldn't work and why we can't try it. And I'm also watching Alberta, and I'm realizing that the day is going to come very shortly when if you don't take this vaccine, you won't have a job and you will be limited in your life. And I saw that in April. And when I came home, we literally hadn't got 10 miles across the border, and our premier at that time had locked down the province. But coming through Montana as we were driving, I said to Pam as we were driving together, I said, you realize if I start treating people and if I don't take this vaccine, they will take everything away we have. And she said, yeah. I says, are you okay? We had 2 kids in university in the States at the time. We were paying their tuition and whatever's going on. And she said, yeah, we can do this. But you see, we'd already been through this a few times. It wasn't our first time. We knew God could do it. So I said, okay. So I started treating people. First person I treated was a was a politician who has told this story many times. And I treated hundreds and hundreds of people for COVID. And as far as I know, I didn't lose a person, you know, and I started realizing two things about that. The fatality rate isn't that high. It was about the same as the flu for a kid, and a little higher as you got older, it got more serious. But I only treated sick people. I didn't treat kids, and I didn't treat people that just were afraid. I treated people that are actually sick. And of all of those, I didn't lose anybody, but I used a lot of medications, and I used it all prescription. I didn't do anything. I wasn't giving people horse paste or whatever you want to call it. Not that I have anything against ivermectin, but I prescribed it properly. And then I got in trouble, and then I lost it all, and didn't lose everything. We still have our house, but yeah, we lost a lot of money, and I lost my position. I lost my job. I was an associate professor, and they took that away from me. They accused me of a lot of things, and they said a lot of things that weren't true, and just plain, whatever. They weren't very nice. But in the middle of all that, we just knew that God could look after us. But it's given me an opportunity. I've traveled. I've talked to people like Dr. McCullough and Dr. Bhattacharya. I've talked to Robert Kennedy Jr. I've talked to people that I've never, ever talked to if I hadn't done what I did. And so this is what God showed me when I was 17. You give it all to him. You might lose it all, but he can give it back to you, but he'll give you something. It says that he'll give you a life more abundantly than you could ever imagine. And that's what he wants to do. But we hold on so tightly to the things we think we need that we refuse to let him do what he wants to do.
Your story reminds me of the verse, "For whoever wants to save their life will lose it, but whoever loses their life for me will find it." And I've heard multiple times in your story, you stopped living your life. You were willing to lose your life in order to live the life God wanted you to live, and he saved you. Gary, we really appreciate your story. We're so grateful for you. We're definitely going to have you back because I know there's more to say, and God bless you and your family and everything you're doing.
Thank you. Thank you.
If you want to help support our mission, keep this kind of conversation and truth on the air, we are viewer supported. We don't take government funds or lobbyists or special interest group. It's only because of the generosity of our viewers. You can go to our website, gotalktruth.com, click on the donate button. You can give digitally that way. If you'd like to do it through the mail, you can. You can make your check payable to Heritage Christian Ministries Association and send it to 246 Stewart Green, Southwest Suite 3260, Calgary, Alberta, T3H3C8. And if you'd like prayer, you can call our toll-free line in Canada, 1-800-915-0056. All right, Dad, we're out of time. We'll see you guys later.
Love you.